Welcome once again to Hobrough.com. I am really excited to have Karsten Knobloch with us from Hanover, Germany. It's somebody who I've had the great pleasure to work with, to learn from, and it's probably the person that I've been trying hardest to get on to Hobrough.com. Karsten Knobloch, welcome, and please introduce yourself, how you'd like to do so.
Hello, everybody. Thank you, Paul, for this invitation. And actually, I'm very sorry that you had such a hard time trying to get me on that video screen in the UK, in the northern UK. I'm in this very moment sitting in my garden in Hanover, Germany, which is a 1-hour flight eastbound from London, UK, and you might be aware that there are even 3 or 4 kings, the Georges in the United Kingdom, who came from Hanover. So I'm kind of royal, let's say, bonds with the United Kingdom. And as a matter of fact, I am a trained surgeon in different disciplines. So I started in cardiothoracic surgery, went over to trauma surgery, general surgery, then to plastic and hand surgery. And in 2012, so nearly 8 years ago, I thought it is time to move on and change momentum and change scope. So I started a private practice in Hanover, which is focusing mainly on sports medicine treatments and mainly non-invasive or minimal invasive. So I'm trained surgeon, and I now try to avoid as much as I can surgery. That's my life in the moment.
Yeah, and you teach all over the world for Storts Medical, right?
Yeah, actually, I am a teacher and a speaker for Storts. I am the communication officer of the ISMST, and I'm the current president since 5 years of the German Shockwave Society. So yes, I am doing quite a lot of talks on in different environments, in different countries, among different people, among physicians, among non-physicians, among cosmetics, and to people with totally different backgrounds, right?
And so let's talk a little bit about the ISMST, because I was introduced to this in Beijing last year, and it was such a fantastic experience as someone that's interested in shockwave. But I was almost shocked to learn it was the 23rd meeting of the ISMST, and you were in the presidency changed each year. You've been president before now, is that right?
Right. Now, action is the history is that the let's say the shockwave medicine politics started in 20 years ago or 25 years ago in 95, when in Germany Richie Thiele, Wolfi Schaden, and others decided to combine their shockwave experience, a very early experience, in a, let's say, club with the common interest to promote shockwaves, to ensure shockwave education. And this started actually in Germany in 95. And 2 years later, because Wolfi and Richie and all the others from different countries were so happy to meet each other on an international basis, they decided to come up with a international society, which is then became the ISMST in 1999. It was first formed in 1997 as a European Medical Shockwave Society, and then renamed 2 years later in 99 in the ISMST. And they promote shockwave education as well. They try to come up with some consensus statements and standards to ensure that the, let's say, the shockwave users get kind of a quality and quality control and the guidance of how to do shockwave medicine in a, let's say, good clinical practice, in a GCP manner in a way. And therefore the ISMST was instituted, and they started early on with an annual meeting, which by definition has to travel around continents. So every single year since 1999, there was an ISMST conference on a different continent.
It's amazing. And it's a shame that it couldn't happen today because this year because of coronavirus. And so given that it was kind of born out of Germany, and you're the president of the Digest, which is the name given to the German group, how does Germany at this moment in time kind of lead the opinion? Or do you think that there's more coming out of China now, or more coming out of other parts of Europe or Australasia? Is Germany, as the people that created this, are they still at the forefront, would you say?
By different numbers, I can say yes. So by the numbers of shockwave machines throughout the country, we estimate, although there are no clear numbers because of different competitors, that around 10,000 shockwave machines are in Germany. So this is the biggest number of shockwave machines installed worldwide. Second largest market is South Korea in the moment with installation. So there are 4,000 shockwave machines around in South Korea, just to give you an idea. And there may be some 2,500 in China, just to give it in perspective. So yes, there is a huge frequency of, or a lot of users in Germany, mainly physicians. And we are the oldest national society, right? And we, because of, let's say, our history, we believe that it's quite important to ensure education, and therefore we started 6 years ago in 2014 with a qualified board certification in shockwave medicine, which is 60 hours of postgraduate shockwave training for physicians, and they have to be board certified, and then they can enroll in the 6 day of shockwave medicine, whereas 1 day on basics of shockwave, 1 day is on shockwaves on the tendons of the upper extremity, 1 day lower extremity, 1 day is on bone and cartilage only, 1 day is only for myofascial shockwave, and 1 day is for shockwaves in wounds, in aesthetics, and lymphedema. So this started 6 years ago, and we have some 1,200 physicians who already fulfilled these courses. So even from that perspective, in terms of a huge curriculum, we think it's quite important to ensure this type of quality. And we then came out 2 years ago with a consensus guideline, which is around 100 pages. And this is first done on several consensus conferences among DGEST members and DGEST board members, because a lot of them, Ludger Gerdesmeyer, Martin Ringeisen, Vinci Auersberg, Wolfi Schaden, has published, let's say, 70–80% of all publications. So we, in several consensus meetings, came up with a kind of a guideline on radial and focused shockwaves for different indications. What are the prerequisites? What are, let's say, overall machines and different distributors? What is our recommendation? And this guideline, first published in German, has been translated last year in English and is now available on the ISMST website as well. And it's now, in that very moment, translated, for example, in South Korea, in Korean as well. So they are adopting our, let's say, recommendations we came out in Germany.
It's incredible. Now, we've done quite a few of these shows on things like tendinopathy. We've done one on bone most recently. You mentioned there about the lymphedema, wound healing, and aesthetics, and even I'd really like to look at stuff around the hand. So could we perhaps start off with lymphedema? Could you give us some information on how that maybe gets treated with shockwave?
Now, the usual treatment for lymphedema is manual lymph compression, as you know, or manual lymph drainage and compression therapy. And this might be, let's say, supported by some kinesiotaping in a lymphatic fashion. So these are the pillars. And the earliest experimental data date back in 2010. So 10 years ago, it was already shown and published that in rats and in mice, lymphedema in experimental settings can be ameliorated by help of shockwaves. And the main, let's say, experience in the moment based on science is for focused. And there are less publications on lymphedema, but there are some showing that even radial might help in lymphedemas. And the idea is that, like on different tissues, shockwave in lymphatics work multifactorial. So there are effects on lymph VEGF, which is the vascular endothelial growth factor for lymphatic vessels. So lymph VEGF is stimulated, so 3-4 months. It takes some time. After this effect takes into place, we have some immediate releases on the fibrotic tissue, which is often accompanied in lymphatic stasis, for example. And you might even influence the lymphatic drainage velocity by radial shockwave and especially by vibration tools like the reactor, for example. So there is good, let's say, experimental data, and there are some early clinical papers, for example, in secondary lymphedema for the upper limb after mammar carcinoma and lymphatic resection on the axilla. There is a pilot study, I think in 2014 or 15, published from South Korea, and they showed that in 6-7 female patients, they could significantly reduce the swelling by 6 focus sessions by some 40%. So there is some reason to believe that shockwaves, focused for sure, radial maybe, and the combination most likely will help in lymphatic problems. And this can be translated, as you know, to a lot of different scenarios. For example, post-surgical, post-trauma, ankle sprain, and so on. So lymphatics are, let's say, a very key component in healing, and often in my, let's say, from my surgical perspective, in an often neglected field.
And so take that forwards then, because you mentioned surgery. So what about wound healing and management of scars, and maybe does shockwave speed up the healing of the wound, or does it just make it a better scarring afterwards?
So it really depends on what are you looking for. What is, let's say, proven in very good clinical randomized controlled trials from Berlin, Christian Ottoman and Bernd Hartmann had shown in the early 2010, 2012, that skin grafting harvesting sites heal faster if you do one focused shockwave session by 3 days. So usually it takes 14 to 17 days for that kind of wound to heal after skin grafting, the harvesting site, and they could speed up healing, epithelialization by 3 days. So on the one hand, you have a faster closure of a given wound. And there is evolving evidence that even the scar quality afterwards might be better if you do shockwave, even maybe preventively. So before, for example, a surgery, you might consider doing shockwaves in order to enhance faster healing and to have a more pleasant scar afterwards, which is especially of interest if you consider facial or aesthetic procedures altogether. So there is reason to believe that scars can be improved in terms of quality, in terms of appearance, and even in terms of pruritus. So the itchiness of a burn scar, for example, can be reduced significantly by focused shockwave. So yes, it helps.
And you've led us on nicely to aesthetics there, right? So I recently had my 48th birthday, and I can notice that I'm becoming more wrinkly, and I have access to all of the shockwave machines. Now, you did a really, really great and inspiring talk in Beijing last year, comparing and contrasting shockwave and Botox, for example. And the key findings that you spoke about was that actually shockwave could be a good adjunct to using Botox, or it could be used on its own. So in the aesthetic world, so what could you do for my face, Karsten, with your machine?
It's always an issue of early assessment, you know, and you being a plastic surgeon and having these kind of consultations quite some time, it's especially in the aesthetic world of utmost importance to first of all get an idea of the diagnosis and to have a proper, let's say, identification of the problems. Have I wrinkles or lines on the forehead? Do I have problems here? Do I have crow's feet? Do I have problems here? And not every line or every wrinkle can be treated the very same. So it's like same thing like in tennis. You have to have an idea of the extent of the problem. We have pretty good data showing that the skin quality is improved by focus and radial shockwave. There is a recent paper published from Maurice Adato from Switzerland in December last year, showing that the size of the pores of the skin in the face can be significantly reduced by some 75% by 6 sessions of radial shockwave. And they did not energetic with 1.2, 1.5 bar with the F15 plastic cup. And they did 20,000 shots on every session in the face for 6 sessions. So quite a lot of shots. But they could, by 3D photography, show that the pore size could be diminished, and therefore the appearance of the skin was significantly better in females. So you can enhance skin quality. You somehow can reduce, I believe, the muscle tone, like it is shown for some 40 papers in spasticity, where shockwaves, radial and focus can reduce the muscle tonus in spasticity. And I believe in the face, the very same holds true if you use it over, for example, the muscles, the forehead muscles, the frontalis muscle, for example, or the auricularis oculi muscle. And Botox is doing the very same, so reducing the tension of a given muscle. And not every wrinkle in the face is, let's say, by hypertensioning or spasticity, but the upper part of the face, usually the muscles are overreacting, and then they are, let's say, approachable with botulinum. And in my view, it appears to be a valid option even to consider radial and focused shockwave in this regard. And I even combined it, so I could extend the amount or the duration of the effect with botulinum toxin, which is usually 3-4 months to 6 months with shockwave only in combination with botulinum. So there is some argument for doing either the one or the other, or even the combination, right?
And when you're using focus shockwave, you're using your self-termed nanopressures, is that right? Which are a very, very low energy flux density.
So the face, by definition, is very sensitive. As you know, there are a lot of, let's say, nerves, and the resolution of your skin in the face is much tiny or much more precise than on different locations in the body. And furthermore, you have some holes in the head, where you might have the esophageal and the frontal holes, where you might cause some problems of ballistic issues like cavitation or what. Therefore, usually if you do focused in your face, and I did it on every location you can estimate, usually it is only possible with focus electromagnetic in between 0.05 to 0.1 millijoule, which is very low to low. Very low is up to 0.05 millijoule, or corresponding to 2 bars. with a radial, and this is a energy level I coined nano energetic, so very low energy. And in the face it appears that even with 1.2 bars, as you show by, as Adato has shown in his face study, you can have significant effects. So it is not necessary, at least in the face, to have that very high energies.
And then moving on to the hand, and not just the hand, but some of the peripheral nerve, like carpal tunnel, but particularly hand therapy, like trigger finger, de Quervains, Dupotrons, this sort of stuff. I know that you've talked a lot about this, and I'd really like to get you to talk about hand therapy and shockwave.
So actually, there are different tissues in the hand and different problems which often occur. For example, bone problems on the scaphoid, because the scaphoid is the bone which heals the worst. So the non-union rates of scaphoid is the highest among all bones in the body because of a, let's say, very precarious perfusion. And therefore, oftentimes, bone fractures lead to non-healing or non-unions of the scaphoid. And the same holds true for the long bones, where it has been shown 20, 25 years ago that shockwave can help healing in these kind of circumstances. And Sergio Russo, in a book I just bought from 2000, published his cohort in a chapter on scaphoid non-unions, and this were 154 patients in the year 2000, which he already have treated by shockwaves with focused high energetic devices with good results. So bones heal on the long bone, and the same holds true for the hand, and this is true for the scaphoid. This is true for lunate perfusion problems like Kienberg disease. This is true for metacarpal pseudarthrosis and so on. Tendons like Achilles tendon, like patella tendon, like supraspinatus tendon. You have flexor tendons causing the trigger finger. You have de Quervains on the first extensor compartment. They react the very same. However, you will have to adjust your energy levels because a de Quervain or a flexor tendon is much more sensitive than a plantar fascia or an Achilles tendon. Therefore, you have to adopt your machines, your radial or your focused machines on the hand. For example, radial with different applicators where you can use, for example, a soft tip, the Atlas applicator, for example, which somehow reduces the energy and somehow reduces the pain. And it allows pretty good treatment, for example, for the flexor tendons and for the de Quervain, for example. And even in focus, you have to have very, very low energy. So in between 0.05 or 0.1 millijoule, and they are efficient on the hand. So the same principle, like on the long bones, on different locations, on bones, on the tendons, work on the hand, yes. However, with special emphasis on the equipment. So you cannot translate your same energy levels to the hand, so you have to adjust them. And the same holds true for the nerves. So we have encouraging data, some I think 10, 12 randomized trial for both radial and focused for carpal tunnel syndrome. So there is evolving evidence that in carpal tunnel syndrome the median nerve will benefit from doing shockwaves.
And in terms of using this combined approach, it seems to me, and I feel very strongly, that combining radial and focused has become my almost close to my sole treatment, and it seems like you use them in combination all the time. What other treatments do you use, such as injection therapy, the new magnetolith? I know you've just got a new imaging device which looks insanely good. So what other things are you using in your practice? Actually,
I'm doing nearly everything non-operatively what you can do. So I'm using technology-wise, I'm using focus and radial and vibration tools. I'm using with different applicators. I'm using the new magnetolith. I'm using a low-level laser device from Scandinavia, the Iradia laser, since 15 years. I'm doing different kind of injection therapy, which is usually ultrasound guided. So I'm navigating by ultrasound control my needle and then can do, for example, sclerosing, polydocanol injections for tendons. I can do hyaluronic acid injections under ultrasonic control. I can do collagenase injections for Dupuytren's. So different, let's say, techniques. And shockwave is, let's say, a very, very, or most likely the most important part of my toolbox. However, it is still part of my toolbox. So I'm doing quite a lot of different therapies. I'm doing exercise therapy. So do not forget, if you consider doing shockwaves or new in the business, the standard treatments. But you can, as I mentioned, for lymphedemas, it's quite wise to combine shockwaves in addition to conventional manual lymph drainage and compression therapy and kinesiotaping. And you will end up with superior results if you combine, for example, shockwaves in combination with your standard therapy. And this is, let's say, accelerating healing, and especially from a patient perspective, is causing pretty happy patients in the end.
And something that's happening in the UK a lot at the moment is there's a movement that seems to want to talk down everything that is a passive therapy. They all they want to do is get people exercising, and they want to do a lot of the psychological work with the patient. And so sometimes when I post stuff around shockwave, I get some of these people jumping on and saying that it's snake oil, there's no science behind it, it doesn't work. Do you have that in Germany, or have you surpassed that? And what sort of things might you say to those people?
Wait a second. In 20 seconds, I'm back with a book. Wait a sec.
Okay.
So here I am again.
Very good.
And this is the book I was referred to 2 weeks ago on CNN, The Death of Expertise. And there is, not only in science, but also in politics, a campaign against established knowledge and why it matters. So there is a tendency, as you know, in fake news, to come into discussion with non-experts. And usually these kind of discussions are fruitless and timeless and whatever. So the death of expertise, I think, is a universal issue. And therefore, I would put it this way: do not forget, if you are a trained hand therapist, do not forget what you usually do, but add shockwaves. If you, for example, consider the CMC1 joint osteoarthritis, consider orthesis in the first line, consider shockwaves second line, consider injections, hyaluronic acid in third line, and then consider surgery fourth step. So put the shockwave in kind of a perspective in your, let's say, therapeutic arsenal, or your toolbox in the end. And do not believe that you can heal everything, even COVID, with shockwaves alone. So this is not the case.
That's perfect, and I'm going to buy that book for sure. Whenever I do these talks, the thing that runs through, that my motivation for doing talks like this with experts like yourself, is that I've gained so much by working alongside you, by meeting people like you at the ISMST. And it's those talks over a nice glass of wine, or over lunch, or in between the conference, which have really catapulted my own knowledge, as well as the content of the conference itself. So I like people to understand who you are. You're obviously a very intelligent man. You've had to look at 0 notes to give us chapter and verse about this stuff. So let's talk about you. Karsten, what is the one thing that is at the top of your bucket list? Forget shockwave for a minute. What's at the top of your bucket list for life?
I'm a married man with 2 healthy girls, and a dog owner and a horse owner. So I'm of utmost importance and that's what I feel in COVID times stronger than ever, to be a good family man in the end. Although I, as you know, traveled as we do quite a lot. But these COVID times, let yourself rethink and readjust or recalibrate, and see how important it is to spend time with your beloved ones. And you never know when it's over, and there are sometimes all of a sudden changes or things change. Therefore, I'm very happy, and that's the main issue. Even in the Shockwave family, that's how we see the ISMST. We see the National Society. We have a approach of which is not common in science, for example, especially not among surgeons, of share collaboration. So we are aware of what my colleagues in science in Shockwave are doing, and we are collaborating and sharing our expertise, and not thinking that we exclusively have the right to own our expertise, but we try to share this. And that's why we do this kind of, let's say, speak out and have these kind of conferences, because what you experience is the same I experienced when I went for the first meeting in 2011. So I started Shockwave in 2006, and it took 5 years, because at that time there was no books, there was not that much of publication, so there was not much of proper training, nothing. So I did everything on my own, and I started with focused for the first 5 years only. So it is at that time, so 15 years ago, it's not comparable to the ease it is to start now with Shockwaves, to have all these facilities, to have online courses, to have books, to have videos. This was not the case 15 years ago.
So what would be if you had to choose one piece of research that's been the most game-changing in terms of Shockwave, is there one paper or one author outside of yourself, obviously, that you think's made the biggest difference?
Our issue is that I'm reading quite a lot, and this is necessary to keep on updated. So maybe every second or third day I screen the PubMed and look in the papers. The issue is that there are reading more and more, I see how good people 20-25 years ago were. So for example, Sergio Russo from Italy, as I mentioned, in 2000, he already published 150 cases of non-unions in the book, and there is no full paper. And this is, in the end, even today, the by far largest study ever done on scaphoids, non-unions, but they did not do it in full paper. They just wrote a chapter in a book, which is maybe an anti-CRA book because it's published in 2000. So there are some of these authors who are very well cited. Look at Henning Lose-Busch, who is a neurologist, and he was the first in 96 to publish a paper using very low energy, nano energy, in children with spasticity. And this was published in 96. So 24 years ago. And he was involved in the development of the brain application of Shockwave with a Neuralith as well. So he was the brain behind the idea to use Shockwaves even to enhance or to ameliorate Alzheimer's disease, which has now been published in a very nice paper in the end of last year in Vienna. So Henning Lose-Busch maybe is one of the guys, I would say, very, very foreseeing and a pioneer.
Oh, that's great. I'm going to look at his work. And finally, before we sign off, we spent some great times together. The hotel in Cape Town. We can't always be on Tabletop Mountain looking down over the world together. But you introduced me more and more to the joys of drinking a good wine. Do you have a favorite wine right now that I should find in the shops and go and buy?
So actually, as you know, I'm usually a Sauvignon Blanc man. And as you know, a go for everywhere wine is a Sauvignon Blanc from Marlborough Country, for example, Cloudy Bay. However, as I expected this kind of question, I have two recommendations from Germany, which are quite recently. So the one is Fritz Haag Riesling from last year, a Riesling from Rheingau. which is a very nice, and it was just recommended 3 weeks ago in our national Frankfurt Allgemeiner Zeitung, and I bought it and had some bottles already, and this is a very nice one. And the other one just came today because of a recommendation on this very weekend in the Frankfurter again from Peter Jakob Kühn, who is the winery of the last and the year before in Germany. And he is doing quite a good of Riesling stuff as well. So look for the Rieslings of Rheingau, Germany.
I'm gonna look at that now. I don't know how quickly we'll get some, but with it being COVID. Karsten, you've been an absolute joy, better than even I anticipated. We've covered so much material. So I'd like to say a very, very warm thank you from myself and everyone watching on paulhobrough.com.
Thank you very much for your attention. And keep up with your good shockwaves.